Welcome back to Section 6 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program, inspired course for non-specialists. In our last lesson, we learned about cognitive behavioral therapy, CBT, an effective therapy that helps people identify and challenge negative thought patterns, as well as engage in behaviors that promote healing. In this video, we will explore interpersonal therapy, IPT, another evidence-based treatment for depression. IPT focuses on improving relationships and communication and resolving interpersonal conflicts, which often play a significant role in depression. What is interpersonal therapy, IPT? Interpersonal therapy, IPT, is a short-term, structured treatment that focuses on the connections between depression and interpersonal relationships. IPT was developed in the 1970s and has been shown to be highly effective for individuals dealing with depression, especially when relationship issues are a significant contributing factor. The core idea behind IPT is that depression can be triggered or worsened by difficulties in relationships such as grief or loss, e.g., losing a loved one. Role transitions, e.g., changing jobs, becoming a parent. Interpersonal disputes, e.g., conflicts with a spouse or friend. Social isolation, e.g., feeling disconnected from others. IPT helps individuals explore how these relational issues might be impacting their depression and works to improve communication, coping strategies, and support systems. The goals of IPT. The primary goals of IPT are to improve interpersonal relationships by enhancing communication and resolving conflicts, to help individuals gain skills in dealing with difficult interpersonal issues such as grief or social isolation, to reduce depressive symptoms by addressing the relationship dynamics that may be exacerbating the person's depression. Unlike CBT, which focuses on thought patterns, IPT works primarily with behavior and communication within interpersonal settings. Key phases of IPT. IPT typically involves 3 phases. 1. Initial phase, assessment and goal setting. During the first few sessions, the therapist works with the individual to understand the history of their depression, when it started, how it has impacted their life, and whether there have been any triggering events, e.g., loss, relationship issues, changes in life roles. Identify current interpersonal issues, such as conflict with family, difficulty adjusting to a new role, or grief from the loss of a loved one. Set specific goals for therapy, such as improving communication with a partner or finding ways to cope with grief. The therapist helps the individual understand the connection between their depression and interpersonal issues, setting the stage for working on these areas in therapy. 2. Middle phase, working on interpersonal issues. This phase is where the bulk of the therapeutic work happens. The therapist focuses on one of the following areas, depending on the individual's needs. Grief, helping the person cope with the loss of a loved one and redefine their relationship with that person. Role transitions, assisting the person in adjusting to new life roles, e.g., parenthood, retirement, job change. Interpersonal disputes, teaching the individual to resolve conflicts in a healthy way and improve communication with others. Social isolation, encouraging social engagement and helping the individual build or reconnect with their support system. The therapist provides skills and strategies for each area, including assertive communication, conflict resolution, and problem-solving techniques. 3. Final phase, consolidation and relapse prevention. In the final phase, the therapist works with the individual to review progress, evaluate how interpersonal relationships have improved, and how the person's depressive symptoms have changed. Prepare for the future. Equip the individual with skills and strategies for managing interpersonal issues and preventing relapse. Encourage ongoing engagement with support networks, emphasizing the importance of continued social support and communication with loved ones. The goal is for the individual to leave therapy feeling more equipped to handle future interpersonal challenges and to maintain healthier relationships moving forward. Let's pause for a moment of reflection. Think about your own relationships, whether personal, family, or professional. Have any of these relationships ever contributed to feelings of depression or sadness for you? How might improving communication or resolving a conflict help reduce negative feelings and build stronger, healthier connections? IPT helps people explore the connections between their emotional and relational lives, which can lead to deeper healing. A real-world example. Maria, a 42-year-old teacher, has been struggling with depression after a painful divorce. She feels isolated and disconnected from her friends and family. Maria's therapist uses IPT to help her explore how the divorce has affected her sense of self and her relationships. They focus on grief over the loss of the marriage, help her communicate more openly with her children, and work on building new social connections. By the end of therapy, Maria reports feeling more connected to her support network and has developed healthier ways of coping with relationship challenges. Her symptoms of depression significantly improve, and she feels more hopeful for the future. In summary, interpersonal therapy, IPT, is a structured treatment for depression that focuses on improving interpersonal relationships and resolving relationship issues that contribute to depression. IPT addresses 4 primary areas: grief, role transitions, interpersonal disputes, and social isolation. The therapy works in 3 phases: assessment and goal setting, working through interpersonal issues, and consolidation and relapse prevention. In our next lesson, we'll explore behavioral activation therapy, a therapy designed to help individuals engage in meaningful activities that counteract the withdrawal and inactivity caused by depression. But before we move on, here's your reflection for today. What interpersonal issue in your life, if any, might contribute to feelings of sadness or stress? How could improving communication or seeking support from others help reduce those feelings? Let's continue building our toolkit of therapeutic strategies.